Did you know that an increasing number of Indian doctors are leaving the US and choosing Singapore instead? It's a surprising trend, but why is it happening? Is it better salaries, lower taxes, easier immigration, or is there something even bigger driving this shift? In this video, we'll uncover 17 powerful reasons why more Indian doctors are saying goodbye to America and moving to Singapore, and some of these reasons might shock you. If you're a doctor, a healthcare professional, or just curious about global career trends, this video is a must-watch. And stick around till the end, because we'll also explore how this trend could reshape healthcare in both the US and Singapore. Before we dive in, don't forget to hit the subscribe button if you love content about global careers, immigration, and expat opportunities. Now, let's get started. Less bureaucracy, more medicine. One of the biggest frustrations for doctors in the US is the overwhelming amount of administrative work. Between insurance claims, excessive documentation, and strict hospital regulations, doctors often spend more time on paperwork than on actual patient care. This bureaucratic overload leads to burnout, frustration, and decreased job satisfaction among healthcare professionals. In contrast, Singapore's healthcare system is streamlined and efficient, allowing doctors to focus on medicine rather than bureaucracy. The government has implemented digital health records, AI-driven administrative support, and simplified insurance processes, reducing the need for excessive paperwork. This means doctors in Singapore can spend more time with patients, improve treatment outcomes, and experience a better work-life balance compared to their counterparts in the US. Many Indian doctors in the US report burnout due to long working hours and an overly complicated healthcare system, which often prioritizes insurance approvals over patient needs. And it's not just an issue in America. Doctors in Canada, the UK, and Australia also struggle with bureaucratic challenges, long waiting times, and excessive government regulations. However, in Singapore, Switzerland, and Germany, medical professionals enjoy more autonomy, fewer administrative restrictions, and a patient-centric approach where doctors, not insurance companies, make medical decisions. These factors make Singapore an attractive destination for Indian doctors who want to practice medicine without unnecessary red tape, enjoy a balanced lifestyle, and work in a high-track career progression. Singapore has a well-structured career path for medical professionals. Unlike the US, becoming a specialist requires a lengthy and highly competitive residency process. Singapore provides clearer and faster opportunities for career advancement. In the US, doctors often spend years in medical school, followed by an intense residency and fellowship program that can take over a decade before they can fully specialize. The process is not only time-consuming, but also highly competitive, with limited residency slots, especially for international medical graduates. Many Indian doctors struggle to secure the necessary placements, delaying their professional growth. In Singapore, the pathway to specialization is more structured and efficient. Medical professionals can transition from junior roles to specialized positions faster with a clear progression system that rewards experience and expertise. The Ministry of Health works closely with hospitals to ensure a steady supply of trained specialists without unnecessary delays. Another advantage is the streamlined accreditation process. Indian doctors with recognized qualifications can integrate into Singapore's medical system with fewer obstacles compared to the US, where foreign-trained doctors often face complex licensing exams and additional training requirements before they can practice independently. For Indian doctors seeking career growth without excessive delays, Singapore presents a more predictable and rewarding path to specialization, making it an attractive alternative to the prolonged and uncertain process in the US. 3. Access to cutting-edge medical tech. The Singaporean government heavily invests in AI-driven healthcare, robotic surgery, and medical research, making it one of the most technologically advanced healthcare systems in the world. Doctors in Singapore benefit from working in a system that prioritizes innovation and the latest medical advancements, giving them access to state-of-the-art tools and resources that enhance both patient care and professional growth. Unlike in the US, where high costs and bureaucracy can slow the adoption of new medical technologies, Singapore integrates innovation seamlessly into its healthcare infrastructure. AI-powered diagnostics, precision medicine, and minimally invasive robotic surgeries are becoming standard practices, allowing doctors to perform procedures with greater accuracy and efficiency. Medical research in Singapore is also thriving, with strong government funding and partnerships with global pharmaceutical companies, biotech firms, and top universities. Indian doctors moving to Singapore gain the opportunity to work in world-class research institutions and participate in groundbreaking clinical trials that push the boundaries of modern medicine. Additionally, Singapore's hospitals are equipped with some of the most advanced medical imaging systems, telemedicine platforms, and electronic health records, ensuring that doctors can make faster and more informed decisions. This level of technological integration makes Singapore an attractive destination for Indian doctors looking to work in a future-focused healthcare environment. Nata 4. Better work-life balance. Compared to the US, where doctors often work exhausting 60-80-hour weeks, Singapore offers a more manageable workload, typically ranging between 40 to 50 hours per week. This difference significantly impacts doctors' overall well-being, reducing burnout and improving job satisfaction. In the US, many doctors, especially those in residency or high-demand specialties, face extreme pressure due to long shifts, overnight calls, and a constant influx of patients. The high-stress environment not only affects their personal lives, but also contributes to physician fatigue and mental health struggles. Work-life balance is often a luxury rather than a reality. Singapore, on the other hand, maintains a structured work schedule that prioritizes both efficiency and doctor well-being. Hospitals enforce regulated shift hours, ensuring that medical professionals get sufficient rest and personal time. Additionally, support from advanced medical technology and well-trained healthcare assistants helps reduce the burden on doctors, allowing them to focus on high-quality patient care rather than excessive administrative tasks. This balanced approach enables doctors in Singapore to have time for family, personal development, and professional growth. For Indian doctors looking for a healthier and more sustainable work environment, Singapore presents an appealing alternative to the relentless work culture of the US. 5. Less risk of burnout. Singapore's structured work environment significantly reduces the stress and exhaustion that many doctors experience in the US. The absence of excessive overtime, unpredictable shifts, and constant administrative pressure allows medical professionals to sustain long-term careers without facing severe burnout. In the US, burnout among doctors has become a major crisis. Long hours, back-to-back patient appointments, insurance-related frustrations, and the pressure to meet hospital quotas contribute to mental and physical exhaustion. Many doctors report feeling overworked, undervalued, and drained by a system that prioritizes efficiency over well-being. Singapore, on the other hand, enforces reasonable working hours and ensures that doctors receive adequate time for rest and recovery. Hospitals are structured to provide sufficient staffing, reducing the need for excessive overtime. Additionally, the government actively addresses physician well-being through wellness programs, mental health support, and policies that prevent overwork. Another key factor is Singapore's patient management system, which utilizes AI and digital tools to streamline consultations, prescriptions, and follow-ups. This reduces the overwhelming workload that doctors often face in the US, where manual documentation and insurance approvals consume valuable time and energy. For Indian doctors seeking a stable, rewarding, and sustainable medical career, Singapore provides a balanced environment where they can excel professionally. Fewer medical malpractice lawsuits. In the US, doctors constantly live under the threat of medical malpractice lawsuits, which not only increase stress, but also drive up healthcare costs. The fear of being sued often leads to defensive medicine, where doctors order unnecessary tests and procedures just to protect themselves from potential legal action. This not only burdens the healthcare system, but also takes time away from essential patient care. Singapore, on the other hand, has a more balanced legal framework that protects both doctors and patients. While medical professionals are still held accountable for negligence, the legal system is designed to prevent frivolous lawsuits and excessive litigation. This allows doctors to focus on delivering the best possible care without the constant fear of being sued for minor or unavoidable complications. Another advantage is the structured medical dispute resolution system in Singapore, which encourages mediation before lawsuits are filed. This reduces unnecessary legal battles and helps maintain trust between doctors and patients. Unlike in the US, where malpractice insurance premiums can be outrageously high, doctors in Singapore pay much lower insurance costs, allowing them to keep more of their earnings. For Indian doctors who want to practice medicine without the overwhelming legal risks present in the US, Singapore offers a much more supportive and less stressful work environment. Higher salary with lower tax rates. While doctors in the US may earn high salaries, they also face heavy taxation, student loan repayments, and high living costs that significantly reduce their take-home income. In contrast, Singapore offers competitive salaries with one of the lowest personal income tax rates in the world, allowing doctors to keep more of their earnings. In the US, federal and state taxes can take away 30 to 40% of a doctor's salary, not to mention additional deductions for malpractice insurance, student loans, and healthcare benefits. Many Indian doctors working in the US find that despite earning six-figure salaries, their disposable income remains relatively low due to these financial burdens. Singapore, on the other hand, has a progressive tax system with a top personal income tax rate of just 22%, significantly lower than what doctors pay in the US, Canada, or the UK. Additionally, there are no capital gains tax or inheritance tax, allowing professionals to accumulate wealth more effectively. Doctors in Singapore also benefit from a lower cost of living in key areas such as housing, transportation, and healthcare compared to major US cities like New York, San Francisco, or Los Angeles. This means that not only do they earn well, but they also enjoy a higher quality of life and financial security. For Indian doctors looking for a high-earning career without the heavy tax burdens of the US, Singapore provides a much more attractive financial environment. 8. Cost of living benefits. While Singapore is often ranked among the world's most expensive cities, doctors benefit from tax savings, housing assistance, and financial incentives that make living costs more manageable, especially when compared to major US cities like New York, San Francisco, and Los Angeles. In the US, high-earning professionals like doctors often struggle with the rising costs of housing, healthcare, education, and daily expenses. Rent or mortgage payments in cities with top-tier hospitals can take up a significant portion of their income, and healthcare costs, even for medical professionals, are among the highest in the world. Singapore, despite its reputation for high living expenses, offers substantial advantages for doctors. With lower income tax rates, a high salary to cost of living ratio, and government support programs, medical professionals can afford a comfortable lifestyle. Many hospitals also provide housing allowances or subsidized accommodations for foreign doctors, easing one of the biggest financial burdens. Additionally, public transportation in Singapore is world-class and highly affordable, meaning doctors don't need to rely on expensive car ownership like in the US or Canada. Education options are also top tier, with international schools and universities offering high-quality programs for families at competitive rates. Ultimately, while Singapore's cost of living is high in certain areas, the financial perks, lower taxes, and work-life balance make it a far more attractive and sustainable option for Indian doctors compared to the inflated costs of major US cities. 9. Affordable housing for expats. Housing in major US cities is expensive, eating into doctor salaries. In contrast, Singapore offers housing allowances, subsidized accommodations, and expat-friendly rental options, making it easier for doctors to find quality living spaces. With efficient public transport and well-planned infrastructure, commuting is also stress-free and cost-effective. Easier immigration and visa process. Indian doctors in the US face long green card wait times and complex visa rules. Singapore's Employment Pass and S-Pass system offers a faster, more predictable immigration process. Unlike the US, where PR can take decades, doctors in Singapore can apply for permanent residency within a few years, ensuring greater stability and career growth. 11. Stable immigration policies. The U.S. immigration system is unpredictable, with frequent policy changes that create uncertainty for foreign doctors. In contrast, Singapore has a stable and transparent immigration process, making it a safer choice for long-term career planning. Doctors can secure work permits with ease and apply for permanent residency within a few years, providing long-term security. 12. Government support for foreign doctors. Singapore actively recruits foreign medical professionals to address healthcare demands. The government offers streamlined licensing, financial incentives, and career support to attract skilled doctors. Unlike the U.S., where foreign-trained doctors often struggle with complex licensing exams and limited residency spots, Singapore's system welcomes experienced professionals, making relocation smoother. 13. Greater professional respect. Doctors in Singapore enjoy high status and public trust, with fewer administrative conflicts and strong government backing. In the U.S., physicians often deal with insurance disputes, long patient wait times, and burnout, which can lead to dissatisfaction. Singapore's efficient healthcare system and patient-centered approach allow doctors to focus on medicine rather than bureaucratic hurdles, earning them greater professional respect. Chapter 14. Efficient healthcare system. Singapore's healthcare system is consistently ranked among the best in the world. Unlike the U.S., where private insurance companies often dictate treatment options, Singapore's system is government-regulated, patient-focused, and highly efficient. Doctors spend less time dealing with administrative hurdles and more time providing quality care. 15. Increased government investment in healthcare. The Singaporean government heavily invests in healthcare infrastructure, research, and technology, ensuring that doctors work with cutting-edge medical equipment and advanced treatment methods. This continuous investment improves patient care and creates better working conditions for medical professionals. 16. Strong Indian community in Singapore. With over 9% of Singapore's population being Indian, expat doctors find it easier to adjust culturally, access familiar food, and build a strong support system. The presence of Indian schools, temples, and cultural events helps doctors and their families feel at home. 17. Long-term job security and growing healthcare sector. Singapore is expanding its healthcare system to meet the needs of a growing and aging population. With increasing demand for doctors, foreign-trained medical professionals enjoy long-term job security, competitive salaries, and career growth opportunities, making Singapore a stable and promising destination for Indian doctors. Conclusion and final thoughts. More Indian doctors are choosing Singapore over the U.S. for better career prospects, financial benefits, work-life balance, and a more predictable immigration system. With less bureaucracy, higher salaries, and access to cutting-edge medical technology, Singapore is becoming a top destination for medical professionals seeking stability and growth. Is this trend the future of global healthcare? Will more doctors follow this path? Let us know your thoughts in the comments. If you want to stay updated on global career trends, expat opportunities, and immigration insights, be sure to subscribe for more.